Hello, all, and welcome to another session of Dr. Miller's NCLEX Review. Today we're going to be talking about hematology disorders. Okay, let's start with iron deficiency anemia, which can impact negatively on young people, people who are pregnant, older people also, people from low socioeconomic backgrounds, for not having adequate nutrients, okay? Young people who have menstrual difficulties may end up having iron deficiency anemia. And how do you treat that? Replacement of iron, transfusion, diet high in iron content, and also emphasis on compliance with whatever iron or medication regimen that they need to comply with. Okay, so what are some signs and symptoms of iron deficiency anemia? Pallor, glossitis, cheilitis, and the stool may look very black stool. Okay, so some environmental factor, inadequate diet, malabsorption, blood loss, hemolysis, or microcystic and hydrochromic conditions. Patient will have, if you look at their labs, abnormal labs such as decrease in their serum iron. They also will have decrease in their total iron binding capacity, decrease in hemoglobin and hematocrit. Who is mostly at risk? Pregnant women, more so teenage pregnancy for non-compliant with dietary regimens, premenstrual or premenopausal rather women, blood loss, older adults, and low socioeconomic background. Let's talk about another condition also known as cobalamin, vitamin B12 deficiency, also known as pernicious anemia, impaired DNA synthesis, GI surgery, someone who drinks a lot of alcoholic beverages, smoking, someone who has gastric bypass, or someone who uses proton pump inhibitors such as Prilosec, Nexium, Prevacid. Those types of proton pump inhibitors could cause a deficiency in vitamin B12, also known as megaloblastic anemia. Patient will have a low B12 because they're not able to tolerate, for lack of a better word, foods, okay, or absorb foods with containing B12. So they would need to get a monthly injection of B12 vitamins. What are some signs and symptoms? Neurological, tingling, paresthesia, beefy tongue. If you look at their tongue, it's red and beefy, and they also will have weaknesses. How do you treat it? As mentioned before, they will give injection intramuscularly uh, for these patients. And how do they diagnose it? There are many lab tests or blood tests that they would normally do, like the LDH, lactate dehydrogenase test. Okay, high levels of LDH is indicative of pernicious anemia. They will also do the Schillings. The boards may ask you, how do they diagnose cobalamin deficiency? By using the Schillings, Schillings, the Schillings test. Another disorder is that of sickle cell trait. Sickle cell trait could impact negatively on someone's overall status because these patients, they are deprived of oxygen. Remember, the red blood cells, they are crescent. They're not nicely rounded. They have a crescent shape where the patient will have lack of oxygenation, more so with altitude. The boards may ask you, you do have two parents, mom and dad, who has sickle cell trait. Both parents have sickle cell trait. Remember, there's a 25% chance of having a child with a full-blown sickle cell. So it is imperative for you to instruct your patient to get checked before they decide of having children. So two traits can bring a child with a full-blown sickle cell. Okay. Sickle cell, it has genetic components. It is an autosomal recessive disorder. Okay. And what are the side effects? Occlusion, necrosis, decreased perfusion on exertion, pain on exertion. So how do you treat it? Bone marrow transplant, O2 therapy, and try to avoid altitude. The higher that they go, the more they will have clinical manifestations. Okay? So that is sickle cell. Anemia. The other test is folic acid deficiency. Okay? What are the some causes? Someone with celiac disease, someone with Crohn's disease, someone who are addicted to alcoholism, someone who has been taking dialysis, such as hemodialysis, or someone with just malabsorption, not able to absorb any foods readily that contains folic acid. It's macrocystic MCV greater than 100 or decrease in folate. What are the clinical manifestations or signs and symptoms? Weaknesses, fatigue, bruising, no neuro symptoms, weight loss. How do you treat folic acid deficiency? Replacement with green leafy vegetables, 1 milligrams per day. Remember, folic acid also plays a major role because it decreases neural tube defect. When we talk about maternity, we'll go over those defects more, but folic acid is given to pregnant patients. It could be while they're pregnant or pre-conception to decrease neural defect, such as Down syndrome or hydrocephalus. Okay, those type of defect, folic acid decreases risk factors for neural tube defects. Another type of anemia, also known as pantocytopenia or aplastic anemia. How do they get it? Infection, or they do have an autoimmune sickness. Okay, they will have a low red blood cell, low white blood cell, and low platelets. All three of the blood types will be low. So what are some signs and symptoms of aplastic anemia? Respiratory fatigue, weaknesses. And how do you treat that? Transfusion, okay, to increase the white blood cells, bone marrow transplant. So aplastic anemia, also known as pantocytopenia. That's a deficiency of the cellular components of the blood. Another type of anemia what is that? Low platelets, increase in international normalized ratio, increase in the prothrombin and partial prothrombin time. So increase in PT and PTT. What are the clinical manifestations of thrombocytopenia? Prolonged bleeding time. How do you treat that? Platelet transfusion, bone marrow transplant, corticosteroids, and all those things. You got to avoid laceration. Use electric razor. You would instruct your patient to use electric razor, and the goal is to avoid getting cut. You want to monitor the labs, the hemoglobin, the hematocrit, and the bleeding time, PT, PTT. Let's go over blood, because sometimes you will have questions on your NCLEX that pertaining to the different blood types. Let's know that antigen and antibodies, antigen on the blood will identify the cells. Antibodies protects the cells from certain antigen. So the blood types, you have 4 types. You have your A, you have your B, you have your AB, and your O. 4 blood types. Okay? So A antigen with a B antibodies. You got to know that if you have A blood, you can donate to someone with an A type or an AB type. And you could also receive blood from an A type and an O type. With B blood type, B antigen, and A antibodies. So who can you donate to? B type can donate to people with AB blood and also B blood. And who can they receive blood from? B type and O type. Let's talk about AB. AB antigen, they have no antibodies. And who can they donate blood to? They only could donate to AB. Who can they receive blood from? The universal recipient. Let's talk about O. O blood type, they have no antigen, but they do have AB antibodies. So who can O blood donate to? They are universal. People with O blood, they are universal donors. However, they only could receive blood from their own O type. So please review the blood types. They do have Rh negative. Say, they may ask you if you have a Rh mother, Rh negative mother, carrying an Rh positive baby, okay, you want to protect the mom from building up antibodies, so they will give ROGAM. So I will discuss that in the maternity section. Let's continue with blood products. You may need to be part of or the different blood products. So whole blood, say the doctor order whole blood. What does whole blood contains? It contains red blood cells. It contains white blood cells. It contains platelets and also plasma. Why do they use whole blood to transfuse? To increase oxygen carrying capacity, for restoration of blood volume. Then you have your plasma. What does plasma contain? The doctor may order plasma, fresh frozen plasma. 1 unit equals to 250 milliliters. Why do they use plasma? Plasma is used related to coagulation factors, deficiencies. Patient is in DIC, disseminated intravascular coagulation. That means the patient is not clotting. Patient is bleeding through all different orifices. Patient is hemorrhaging. Vitamin K deficiency. Patient has liver disease or anticoagulated patients. So if you were to ask you, why do you need plasma? These are all the factors as to why they would use plasma for transfusing the patient. Then you have your packed red blood cell. Know that 1 unit equals 250 milliliters, and it replaces blood loss of 500 milliliters. It also will increase one's hemoglobin around 1% and one's hematocrit around 3%. Why do they use packed red blood cells? To increase the red blood cell mass. Also, patient who has symptomatic anemia. Platelets. Why do they use platelets? Platelets, just know that 1 unit equal to 50 milliliters, and it increased their platelets by 10,000 units. Remember, platelets, the normal platelet could go from 200,000 to 400,000 plus. Why do they give platelets? To prevent or control bleeding. When the platelet counts are low, patient is at risk for bleeding. Another blood test, cryoprecipitate. Why do they use that? Significant hypofibrinogenemia. I did batch that. They also use that for hemophilia patient, excessive anticoagulation patient also experiencing DIC and von Willebrand's conditions. So cryoprecipitate 6 pool units prepared from plasma contains clotting factors. Another type of infusion that you should know, albumin. What does that do? Albumin moves water intravascular space isotonic fluid and 25 hypertonic. It uses in hypovolemic shock, burns, peritonitis, pancreatitis, and postoperative albumin loss. Some adverse effect that a nurse must monitor for in the event patient having some changes like pulmonary edema. You want to monitor for respiratory issues, congestive heart failure, high blood pressure, anaphylaxis, hypervolemia, and tachycardia. Blood transfusion. As you all know, when you're administering blood transfusion, it should be done by 2 licensed practitioners. One will read the patient's chart against the blood to ensure that what you're hanging is correct. Okay? You want to go over and explain to the patient what you're about to do. So blood transfusion used to replace blood volume, preserve oxygen carrying capability, or increase coagulation capabilities. You may have questions such as autologous blood transfusion. They donate their own blood before anticipated surgery. So the patient will retransfuse their own blood. So to initiate a blood transfusion, you want to type and cross match. Don't forget that. Type and cross match. You want to ensure the informed consent is signed. Each unit of blood is within 2 to 4 hours. Begin with normal saline with a Y administration set to prime the tubing. Do not infuse any solution containing dextrose. When you're administering blood, it has to be normal saline, 0.9 normal saline. Because if you infuse dextrose, it's going to cause the blood to lyse or be destroyed. You want to inspect any leakage, unusual appearance like bubbles or purplish color indicate if that blood was contaminated. Roller clamp. Remain with the patient for the first 15 to 20 minutes. What are you observing? Any untoward allergic reaction the patient may have. You want to flush tubing with normal saline if given more than 1 unit. And you want to use fresh tubing. Blood transfusion reaction. Patient could start having chills, low back pain, pruritus, itching. Okay? So what would you need to do? Patient could say, nurse, I'm having difficulty breathing. You want to stop the transfusion. Stop the transfusion.